but for every American. What you can do is implement the practices outlined in the President's coronavirus guidelines today to accomplish our objective. We slowed the spread, we flattened the curve, we saved lives. And then during the outbreak across the Sun Belt this summer, when we saw positivity rise to nearly 10%, the American people, officials at the federal and state level stepped up again. And we put that outbreak in the past. And even as we see help on the way, vaccines being developed at a historic pace, as I mentioned before, as we gather today, we are seeing cases and positivity rising across the country. But we approach this moment with the confidence of experience. We know the American people know what to do. We have forged a partnership that is truly seamless with state and local health authorities. And as we'll describe to you today, we've continued to work 7 days a week, all throughout this year and up to this very moment, to make sure the American people have access to the health care that we want any member of our family to have as we meet this pandemic. Now, cases are rising throughout the country. Positivity in the last 30 days has risen from an average of 5% to 10%. And to that end, we've continued the mobilization that began at President Trump's direction early this year. We increased testing from a standing start in the month of February to now, as of today, we've completed more than 170 million tests. And we continue to approve new tests, including an at-home test that the FDA just recently approved. And we're distributing more than 150 million Binax tests to schools and nursing homes around America as we speak. Our mobilization of supplies, you will hear described in great detail, continues to surge each and every day. We actually are able to track PPE and supplies on a hospital-by-hospital basis. And so we're carefully monitoring, we're working with state officials, with hospitals.
Those agencies for an effective transition. The President-elect was very careful in choosing his words, but I'm not going to be careful in choosing mine.
An exercise of what they would do if there was a pandemic that hit from Asia. So this is real learning that can help us.
Thank you, Mr. Speaker. Mr. Speaker, I support the three amendments.
More than 70% since those heartbreaking days of April. In May of this year, of course, as the President spoke last week in the Rose Garden, we launched Operation Warp Speed, focusing on accelerating the development, the manufacture, and the distribution of a safe and effective vaccine. And you'll have an update today on the progress from two of our leading experts and those that are coordinating Operation Warp Speed. What I want to say in the midst of all of this to the American people as we begin this briefing is that with the massive increase in testing over the last 10 months, with PPE and medical supplies and equipment that are available to the American people, with the medicines and the therapeutics, and very soon the vaccines that are available, America has never been more prepared to combat this virus than we are today. But our pledge to each and every American looking on today is we're going to work around the clock to keep it that way. We're going to make sure that hospitals that are seeing patients coming in on an increasing basis know that we're going to work around the clock to meet that need. And you have our continuing pledge and the practice of experience that we've had along the way. So in a few moments, you'll hear from members of our team. We're going to begin with Dr. Deborah Birx, who's going to describe what we're seeing in the rising cases. Literally every day for members of the task force begins with detailed analysis of what's happening across the country, and she'll give you our very best information on rising cases and hospitalizations. That information is summarized each and every week for the nation's governors and provided to them in particular detail as well. After Dr. Birx speaks, we've asked General David Sanford with FEMA to provide an update on our ongoing efforts to provide PPE and medical supplies to our hospital needs. We're literally going to make sure, as I said, that as we see cases rising, that we're meeting the needs in hospitals around America to stand up the response that any one of us would want a family member to be able to have access to. Then we've asked Dr. Fauci to give us an update on the incredible and historic progress on the development of vaccines. It seems like with good news happening every couple of days, that's a great encouragement to the American people. And then General Gus Perna will outline our distribution plans on Operation Warp Speed. I was at FEMA today, received a detailed briefing about our distribution plans, and here today to make that presentation to the American people. And it is in a very real sense putting us in a position that literally the day after one of these vaccines is approved, we'll be shipping vaccines to the American people, and within a day after that, we'll be seeing those vaccines injected into Americans, with a particular focus on those most vulnerable and those that are providing health care to the American people. Finally, we'll talk with a bit about the way forward as state and local governments are continuing to act and take mitigation measures to slow the spread. You can assure them, as we did governors again this week, that we'll support decision-making at the local level. And we'll continue to support decisions that are made in each individual community based on the circumstances on the ground. But that being said, President Trump wanted me to make it clear that our task force, this administration, and our president does not support another national lockdown. And we do not support closing schools. You'll hear from Dr. Robert Redfield of the CDC that actually the CDC never recommended that we close schools at any point this year. And Dr. Eleanor McCants-Katz, who is also serves with substance abuse and mental health services at HHS, will describe the real costs to children being away from school. But in every one of these cases, we're going to give you the best information that we have up to this moment. And I just want to assure the American people, as I trust that you will have a sense today, that we're going to continue to work around the clock to meet this moment. But help is on the way. We have every confidence that in a short period of time, we could have one or more safe and effective vaccines for the American people. And as each of us does our part, in partnership with state and local officials, each of us does our part to look after our own families and our own communities. I believe the day is coming soon when we will put this coronavirus in the past. With that, let me introduce Dr. Deborah Birx, who will update us on cases. General Perna, thank you. And as he said, from the time President Trump announced Operation Warp Speed, General Perna and his team have been working literally around the clock to build the distribution plan that you see that's in effect. And I hope you all heard that. I asked him how many of those kits have already been manufactured for merging with the Moderna product, and they've already assembled 100 million kits that are ready to go, and that's the supplies that are necessary for administering the vaccine. I must tell you, having received my latest briefing today over at FEMA from Operation Warp Speed, I think every American can be proud of the fact that we have a plan in place, that the moment that the FDA concludes that that vaccine is safe and effective, we have a system in place to begin within 24 hours shipping that vaccines to hospitals, healthcare facilities, and 24 hours after that, literally injecting that vaccine into Americans. And we'll also be continuing to develop the prioritization, working with states about their plans, and maybe Bob Redfield of CDC will reflect on that as well in a moment. CDC will create a recommendation for priorities of who's to be immunized, but if history is a teacher, we know that we'll focus on those most vulnerable. We'll focus on our healthcare workers and first responders at the early going. But it's truly inspiring to me to see the incredible work that Operation Warp Speed has done. And General Perna, I want to thank you for your dedication. With that, as I said, we've continued from the very beginning to operate an approach at the federal level that is federally supported, state managed, locally executed.
Look into executive branch misconduct, because you basically are giving
Biden team, how much contact has there actually been between?
When he asked me,
and all ranks.
your moving company found.
Again, we're not calling for a national lockdown, and we won't. But beyond that, there have been some actions taken, and jurisdictions around the country with regard to closing schools. I wanted the American people to know that it is the position of this task force, of this administration, and of the CDC that we do not need to close our schools. I want to invite Dr. Redfield to come forward to speak about that, but I want to emphasize what he's reminded our task force of many times, that actually at no point in this pandemic has the CDC ever recommended closing schools. And the more we've learned about this virus, the more it's simply affirmed that. We think our kids belong in the classroom. We're absolutely committed to continue to provide resources so our kids, our teachers, our administrators can safely get back to school. But with that, let me introduce Dr. Redfield, and with him, Dr. Eleanor McCants-Katz at HHS, who is an extraordinary leader. She's going to speak about the unintended consequences of shutting our kids out of the classroom around America. And then I'll have the Secretary have some closing remarks. Dr. Redfield. For sharing the news. And know that this team, working in cooperation with our states, with the cooperation of the American people, has made great progress. And we're getting there. We're getting there, America. And as I said at the outset, let me say, I hope it's more in evidence as you hear from this team about the abundance of supplies that are available today for our hospitals, our ability to track what's happening at your local hospital to make sure that it has the PPE and the equipment and supplies to provide the health care that your family may need. I hope as you heard about the extraordinary distribution plans of Operation Warp Speed and the confidence that Dr. Fauci expressed today, and the news that one of those research companies is going to submit an emergency use authorization tomorrow on the very first vaccine, that we are literally, we could well be just a matter of a few short weeks away from a vaccine being available across this country for the most vulnerable among us and for those that are caring for them in our hospitals and our clinics. I hope everything you've heard today gives evidence of what I said at the start, that America has never been more prepared to combat this virus. But let me be clear as I close, we all have a role to play in the days ahead. And you heard this team say, as we see that finish line, as we see light at the end of the tunnel, as President Trump often says, and you should see evidence here that we are rounding the corner to that day that we have a vaccine for the American people. We do want to encourage every American to continue to do your part. Wash your hands, practice social distancing, wear a mask when social distancing isn't possible. Do your part to put the health of your family, the health of your neighbors, the health of the people in your community first. We are all in this together. And as I've said many times from this podium over many, many months, I know that with the cooperation of the American people, with our incredible doctors and nurses and first responders, with the extraordinary partnership of federal and state and local health officials, we will get through this. And we will get through this together.
Mr. Vice President.
Thank you.
Mr. Vice President.
I think it's very clear. I think it's very clear that there are people in your profession that write fake news. You do. She does. There are people in your profession that write fake news. They would love to see me for whatever reason, because we've done one hell of a job. Nobody's done the job that we've done. And it's lucky that you have this group here right now for this problem, or you wouldn't even have a country left. Okay, go ahead, Mr.
How many deaths are acceptable?
Yeah. How many? None. Okay, how many deaths are acceptable to me? None. And what we've done is redesigned it very quickly with the help of the people behind me, and we're now in very, very strong shape. I think we'll be announcing, as I said, Sunday night, and this will start very quickly. And we're getting, I said before, exponentially better. Every day it's going up substantially. We have an incredible apparatus built now. But no, I don't want to test 350 million people. The next 8 weeks are critical. We can learn, and we will turn a corner on this virus. We have tested by far more than anybody. We're testing more than anybody right now. There's nobody even close. And our tests are the best tests. They're the most accurate tests. So it's really good. By the way, while I'm on it, I also spoke with Prime Minister Abe of Japan last night, and I congratulated him on a wise choice. I think it's going to be a fantastic Olympics 2021. I think it's going to be a fantastic Olympics. It was the absolute right decision to delay it for a full year and now have a full, beautiful Olympics. It's going to be very important because it's probably the first time, maybe ever, or certainly in a long time, that it was on a odd year. It's always on an even year, they tell me. But he's going to have a fantastic success, and now they'll have even more time. He didn't need any more time. Everything was perfectly ready. What a job they've done. But Japan, I want to congratulate Japan, the IOC, and Prime Minister Abe on a great decision. I think it's going to be a fantastic Olympics. I told him I'll be there. I'll be there. So that's it. All right, maybe one more, Steve. Go ahead.
When you have this G20 meeting tomorrow, what sort of coordinated response are you expecting?
Coordinated. We're going to have a meeting with the 20 nations total, including us, and there'll be it'll be a conference call tomorrow morning sometime. I look forward to people I know I like. I think in every instance I like every one of them. But it'll be an interesting call. You'll be the first to know. And we'll be changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does. But it will, I guess, somewhere out there. There's some bad ones over the years, and I guess that'll continue to an extent. But we hope it never happens, but we're going to be changing a lot of the old rules and specifications and regulations. We're also doing some very large testings throughout the country. I told you yesterday that in South Korea, and this is not a knock in any way, because I just spoke with President Moon. We had a very good conversation about numerous other things, but they've done a very good job in testing. But we now are doing more testing than anybody by far. We do more in 8 days than they do in 8 weeks, and we go up on a daily basis exponentially.
Thank you.
Thank you very much.
Oh, practice that.
Okay, I like that. That's good. I believe today you broke the 150 mark for the virus. We have 150 countries, over 150 countries where you have this virus, and nobody would ever believe a thing like that's possible. Nobody could have ever seen something like this coming, but now we know, and we know it can happen and happen again, and if it does, somebody's going to be very well prepared because of what we've learned and how we've done. It's been incredible how we've done. Remember, there's more tests than anybody by far. And no, I don't take responsibility at all, because I have had so many people, and they want to practice social distancing, and they want to practice no handshaking. No handshaking. They're not going to walk around hugging and kissing each other in the office when they come back, even though they may feel like it. They're going to wash their hands more than they've ever done. They're going to do all the things you're supposed to do. But Steve, you know what? It's time. People want to get back to work. I have had so many people, and they want to practice social distancing, and they want to practice no handshaking. No handshaking. They're not going to walk around hugging and kissing each other in the office when they come back. On this virus, some of the doctors say it will wash through, it will flow through. Interesting terms. But the country wants to get back to work. Our country was built to get back to work. We don't have a country where they say, hey, let's close it down for 2 years. We can't do that. It's not our country.
The doctors have said you might have it even if you don't have symptoms. Are you being selfish by not getting tested and potentially
Well, I didn't say I wasn't going to be tested.
Are you going to be?
Most likely, yeah. Most
When
likely.
do you think
Not for that
that'll
reason, but because I think I will do it anyway. We sent, over the last day, 4,000 ventilators to New York. And I spoke with the governor about that. He was happy. I spoke with the mayor also about that. Mayor de Blasio, he was very happy. It's hard not to be happy with the job we're doing, that I can tell you. Common sense measures, a lot of it's common sense.
Mr. President, you tweeted earlier linking the closing of the country to your election success in November. Is this Easter timeline based on your political interests?
What do you mean by my election success? No.
You tweeted, you said that the media wants the country to remain closed to hurt your odds of being reelected.
The media would like to see me do poorly in the election. I think
lawmakers and economists on both sides of the aisle have said that reopening the country by Easter is not a good idea. What is that plan based on?
Just so you understand. Are you ready? I think there are certain people that would like it not to open so quickly. I think there are certain people that would like it to do financially poorly because they think that would be very good as far as defeating me at the polls. $27 billion to build up the strategic national stockpile with critical supplies, including masks, respirators, pharmaceuticals, and everything you can imagine, because it was very depleted, like our military was depleted. Now we have a brand new military. Never had a military like this. We have equipment either coming or it's already come. For the most part, it's already come, but we have a lot of things that will soon be coming. Planes, missiles, rockets, lots of things. But the stockpile was very depleted, like everything else. America continues to gain ground in the lines and making the sacrifices required to overcome this terrible threat. More aggressively, we commit to social distancing. So important. Social distancing, such an important phrase. And we do it right now. The more lives we can save, and the sooner we can eventually get people back to work, back to school, and back to normal. I encourage the House to pass this vital legislation and send the bill to my desk for signature without delay. I will sign it immediately. We will have a signing, and it'll be a great signing and a great day for the American worker and for American families, and frankly for American companies, some of which were having the best years they've ever had these last few years, and then a little bit less than a month ago they went into a position that they haven't seen because of the hidden enemy, the virus. And let me tell you, some of the people that took the biggest advantage of us are allies. You know, we talk about allies. They took advantage of us in many ways, but financially as well as even militarily. When you look here, I think it's very clear that there are people in your profession that write fake news. You do. She does. There are people in your profession that write fake news. In other words, you couldn't go there if you wanted to. If I wanted to go there tonight to look at Romeo and Juliet, I'd love to see Romeo and Juliet tonight, right? You know what would happen? They say, sorry, 250 people or 50 people, whatever it might be down to. Go ahead. Because we've done one hell of a job. Nobody's done the job that we've done. More aggressively, we commit to social distancing. So important. Social distancing, such an important phrase. And we do it right now. We have 150 countries, over 150 countries where you have this virus. And nobody would ever believe a thing like that's possible. Nobody could have ever seen something like this coming. It will go away. Just stay calm. It will go away. They're all playing games against us, okay? They've been playing games against us for years, and no president has ever done anything about it. But we've been treated very, very unfairly by the European Union. They wouldn't pay, and we were paying for everybody. We're paying now because of me. They're paying a lot because we've done one hell of a job. Nobody's done the job that we've done, and it's lucky that you have this group here right now for this problem, or you wouldn't even have a country left. Okay, go ahead. They had a very big failure with swine flu, a very big failure. We commit to social distancing. A lot of this money goes to jobs, 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 and families, families, families.
What do you make of that?
Well, I just think it's a nasty question. We want them to use the money for the companies and the planes or whatever they may be helping to get over this rough patch. And I don't think it's going to end up being such a rough patch. I think it's going to, when we open, especially if we can open it, the sooner the better, it's going to open up like a rocket ship. I think it's going to go very good and very quickly. So important. Social distancing, such an important phrase. And we do it right now. The price of oil went down quite a bit, so we're going to fill it up. It's a good time to fill it up. But the stockpile was very depleted, like everything else. But we now are doing more testing than anybody by far. I want to come way under the models. The professionals did the models. I was never involved in a model, but at least this kind of a model. But you know what?
So wash your hands, use common sense. Together, we'll get through this. Together, we'll put the health of America first.